Mental Health Carers ARAFMI is the peak body for mental health carers in New South Wales. We do systemic advocacy, which is basically harvesting the experience of mental health carers and using that experience to try and come up with ideas and models to improve the system for everyone.
I first got involved with mental health because my youngest son became unwell and was admitted to an acute unit here in Campbelltown and eventually diagnosed with schizophrenia. It was a very traumatic time for our whole family, and that was really the first time that I can recall ever being involved with somebody with a mental illness. And I realised that it was so hard to navigate the mental health system, and I decided that I didn't want others to go through what we went through. I wanted to find ways to make it easier. Beautiful Minds began when a whole group of carers came together and we started to fundraise and do all sorts of things, and eventually Harmony House was opened in 2008. Waratah was our first major project, and it's probably the one I'm most proud of. The garden area was a dust bowl, absolutely a dust bowl. We redeveloped that whole space and created a beautiful gardens, which the patients in that facility maintained and really took ownership and felt supported by their community. They know that Beautiful Minds does this work, and they really appreciate what we've done. That garden went on to win the Campbelltown Commercial Garden of the Year award. This is Burunji, the youth acute mental health unit, and that is so important because if we can make changes here, we can make changes in the whole of their lives.
It was a quite dark time for me. I was very unwell at that time. The time here was very helpful for me. It kind of did put things into perspective for me to get better. It's just that looking back at it, I do wish there were some things that were a bit better about the unit. I didn't really talk to many other patients. There was not much to do outside. I didn't find the motivation to go outside.
Like having beautiful places to recover in and do all of those evidence-based therapies that have been shown to be very, very effective, like yoga, sports exercises, having calm spaces, having social spaces, really instills hope and maintains people's dignity and shows our patients that they're valued, by the health service, by the communities.
Burunji needs a whole lot of resources put into it because there's nothing in the outdoor areas to support recovery at the moment. Beautiful Minds want to change that, and they want a Friends of the Acute unit to continue that work.
ARAFMI really loves the Beautiful Minds model of Friends of the Acute unit because we think it's akin to creating a P&C for the mental health facility, and we know that P&Cs do great work in finding extra resources to enhance education. We can have the same thing happening for mental health.
Other areas in the community have got groups that are involved with them and help them to be able to get the resources that they need. But it's been fantastic working with Beautiful Minds because I guess they've been able to come in and be that link with the community for us and to be able to gain access to resources that we wouldn't otherwise have access to.
If there are more activities, things that actually interest the patients, I know that it could help them get to the place that they need to be. It could help them in the outside, and if they feel like they're going to be destructive in any way, whether it be physical or emotional or anything, they can maybe even take the stuff that they have learnt from Burunji and take it with them in their everyday life.
ARAFMI would love to see Friends of the Acute Unit picked up as a model right across New South Wales because it doesn't just raise the awareness of mental health needs and reduce the stigma in the community, it provides a way of funding those optional activities that turn out to be crucial to robust mental health recovery. Because what we know supports recovery in the community in the long term is having somewhere to be, having something to do, having something to care for, and someone that cares about you. And we get that by engaging with our community, by engaging with the activities of ordinary life. And those things are supported by the sorts of resources that the Friends of the Acute Unit can bring to a hospital. And we think that that's a really great thing for everyone in the community of New South Wales.
My son, my son is really well. He's he's only ever had one episode. While he continues to live with schizophrenia, he is working full time. He has a girlfriend. He lives independently, mind you, in our garden flat, but it is independent. He has a dog and a car, and he's enjoying his life, and he's a contributing man. A happy man, and he, while he still lives with his illness every day, he just gets on with it, and it's just terrific. I think he's a hero.